Greetings. My name is Jared Fields. I am the Vice President of the Emerging 100 of South Metro Atlanta. We would like to thank everybody for coming out tonight to hear us speak about the importance of personal health during the pandemic. Tonight, we have some great speakers for you all that are in the healthcare industry here in Atlanta. They have plenty of years of experience, and we just want to make sure that we drive in how important it is for you to maintain your personal health and to make sure everybody else safe during these times. Without further ado, I'm going to introduce our moderator, Mr. Will Ayers. He currently works for One Digital here in Atlanta. He has plenty of years of personal PR experience. Please, I would like to welcome Will Ayers.
Hi, my name is Will Ayers. I'm a marketing professional here in Atlanta, Georgia, and a member of 100 Black Men of South Metro. It's truly an honor and a pleasure to be here this evening with these distinguished healthcare professionals for Health is Wealth, the importance of personal health during the pandemic. 2020 was a very challenging year for everyone, especially the Black community. COVID-19 and many other issues have been running rampant throughout the Black community. So we felt like it was very important that we have a discussion today with Black professionals who are at the forefront of creating meaningful change in the healthcare industry. Like I said, it's truly an honor to be here. I'm super excited about this conversation. And without further ado, I will let our panelists, our esteemed panelists, introduce themselves and just talk about what they do on a day-to-day basis.
Good evening. My name is Michelle Allen. I'm with the Georgia Department of Public Health, where I proudly serve as the State Infectious Diseases Section Director. And that means STD, HIV, and TB come together to make one section. Thank you so much for the invitation, and I am pleased to be here tonight.
Good evening, everyone. My name is Jenny Walker. I am a family nurse practitioner. I've been in the healthcare field for 14 years now and a nurse practitioner for the past 10. I've worked in labor and delivery, acute, urgent, and primary care, and I'm now a clinical implementation specialist for a company called Marathon Health. So I travel around the country and I open clinics in different areas for corporate companies as well as for school districts. I'm also a travel nurse and I'm on the front lines for COVID, currently working right now at Wellstar Cobb. Thank you for the invite tonight.
Good evening. My name is Dominic Mack. I'm a professor of family medicine at Morehouse School of Medicine, the director of the National Center for Primary Care, and also the director of the National COVID Resiliency Network, COVID-19 Resiliency Network. Looking forward to the discussion tonight. Thank you for having me.
Hi, my name is Jason Panda. I'm the owner of B Holding Group B Condoms. We are the only Black-owned condom company. We're based out of Atlanta, Georgia. We've been in business for about 10 years, and we supply about 18 states across the country with their condoms that are distributed through public health agencies and nonprofits.
Hello, I'm Marlon Miller, just joining in on the call. My friend Jenny Walker is one of the presenters. Just seeing what type of material you guys have to offer, and I'm looking to hear what you guys have to say.
That was amazing. That was amazing. Now, something that I love to do is just to really tap into the journey and tap into the mindset of what inspired you to get in the healthcare field. This is a question for all of our panelists tonight. What inspired you to chase your current profession and get into the healthcare industry? I'll start with you, Michelle.
So for me, I was looking for a job and found a career, and most people look for careers and find jobs. I truly think it's a blessing, and I think you are only blessed to be a blessing. I actually started in the field as a disease investigator. So now you would probably hear that role as a contact tracer. I started in public health in 1996. So I like to call myself an old public health lady. For a while, I worked exclusively with syphilis. And one of my nicknames professionally is Syphilis Girl. I love it. I wear it like a badge of honor. It was like, Michelle, you go after syphilis like you got on the cape. And I'm trying to tell you, health disparities are very, very pronounced when it comes to sexual health. And that's not a conversation we always get to have. And as it relates to COVID, prior to this pandemic, chlamydia was probably the #1 notifiable anywhere. So definitely we need to make sure we have those conversations. But I think that I have an interesting journey, and I feel like if I'm here, anybody could be here.
For myself, I would say my mom definitely got me into healthcare. She's a home health aide and has been. My mom is an immigrant from Jamaica. When she came here, it was full force into the healthcare field. I've always grown up with it. Not only is my mom a nurse, both my sisters, 3 of my aunts, and my stepdad are all nurses.
Wow.
So for me, when I got into nursing, initially I wanted to go the MD route, but what I found was I was more beneficial teaching patients from the ground up. So being there to be that patient advocate, I love being a bedside nurse. But now also being a nurse practitioner, I get to teach people through chronic care management. In terms of COVID, definitely what I've seen working front lines with COVID, I've been doing COVID contracts as a travel nurse for the past few months, is a lot of people just aren't educated in how they can protect themselves by doing simple things, or they feel like it won't touch them. So I would say definitely going into this panel, I hope what people get across the most is education is key.
Jason?
Oh yeah, so with me, my journey was a little bit different. Prior to starting condoms, I was actually an attorney, and I used to practice biopharmaceutical patent law. So, I did my undergraduate at Morehouse. I went to Georgetown to practice law, and I was kind of moved by the disproportionate impact of different diseases like, HIV and AIDS, STIs, whether they be chlamydia, gonorrhea, syphilis, primarily in the Black community. And I really saw there as being an opportunity to be able to hopefully close health disparities that you find between like the Black community and then the broader community by focusing on the one protective barrier that I saw, which were condoms. And when I saw an opportunity to really be able to not only educate, but be able to move the culture further ahead and be able to incorporate kind of like cool and sexy elements in order to be able to provide, not only education, but better health outcomes in our community. So with that said, that's when I decided to kind of like do a 180 and leave my kind of comfortable job in law to be able to move forward and go into, the practice of contraception or family planning.
And Dr. Mack?
Yes, like Jenny is my mother. Parental influence is great. She told me I was going to be a doctor since the time I was born, I believe, and I didn't know what it was until I went to college and realized I had to go into pre-med. But anyway, I ended up going to Meharry. Had a lot of mentors who served in the underserved communities, and that stuck with me. So I went into family medicine, worked at FQHC. I worked with Michelle before, but actually got into academics, but ended up getting into pandemics after Hurricane Katrina. Helped to rebuild the health system down there in the Gulf Coast, working with giants like Dr. Satcher and Dr. Russ at Morehouse School of Medicine. That helped me with disasters and pandemics, and also got into grant writing and research. And now we had the opportunity to compete for some funding around the COVID. And now we have the National COVID-19 Resiliency Network, which was a competitive grant. So that's kind of my journey. I've always been serving the underserved since I've been in the medical profession.
Love that, love that, love that, love that. Just to open up the dialogue a little bit more, in the Black community, conversations about healthcare at the dinner table, they don't necessarily go on a lot. Why do you think it's been such a challenge for people of color to talk about STDs or just general personal health issues that may be damaging their family members or just their own selves?
So I'm a Southerner if my accent did not give me up. And a lot of things that we do, we think about how to self-soothe and how to take care of it at home. If I had a dime for every time somebody told me they put butter on it, that they use some turpentine or some home remedy. And I think that we are such a strong and resilient community that we don't often think about that it is okay to seek help. And I believe health and wellness is also inclusive of mental health. So some things that we have that are stigmatized, and I think have been a barrier to seeking care. But also I think that access is sometimes an issue. So for me, I've seen people not want to come into health departments because they didn't want to be seen, not wanting to come into health departments because they didn't want to disclose something about their personal behaviors or their orientations. And so I can tell you that stigma has a lot to do with people not seeking services. And then also you have, in this day and age with social media, good information and bad information has equal opportunity and equal access. So sometimes when people make decisions about what they should do, they don't always seek professionals. They seek sources of where they receive information, and they may not be the most accurate sources.
Now, Dr. Mack, you spend a lot of time on the equity and research side. Just talk about some of the things that you guys are doing over at Morehouse to kind of combat some of those issues and some of those things that Michelle previously mentioned.
Yeah, we do a lot of health equity research. Some of it's community-based and some of it's just working with what we call big data, health equity, big data. But what we do is we do the research to study the problems and the gaps, some of the things that Michelle talked about the stigma, the attitudes, and what are those gaps? So after you study them and you do the research, you also have to do the type of research which leads to implementation, where you develop solutions to fill those gaps. That's around COVID-19, chronic diseases, sexually transmitted diseases, etc. So and I just wanted to add something to what Michelle said to your last question. We have a history. You go back to slavery, we were denied access to healthcare. You come up to experimentation, the syphilis experiment and Tuskegee experiment, and you see the issues now we have with taking vaccines and others. Not blaming everything on that, but just adding another reason. Our traditional relationship with the health system hasn't been a good one. We used to putting our illness on the back burner. So some of that is carrying over to what we're doing today.
Now, Jenny, you said earlier that you've been opening up facilities in marginalized communities. Just tell our audience what that looks like and some of the obstacles that you guys are facing on the front lines, bringing these facilities to people that really need it.
I would say one of the biggest obstacles that we've been facing is being welcomed into some communities. You know, when you are a part of a big entity like my company, Marathon Health, you know, people don't want to feel like you're coming in to kind of take over. So we've actually had a lot of pushback from some areas, from like the mayors, from community leaders and things like that. I would say from a patient standpoint, just piggybacking off what Michelle said, it's really hard to get people in underserved areas to trust you, to feel comfortable, you know, letting you know what's going on with them, how long it's been going on with them. A part of it is shame, you know, and a big part of it is wanting to help others before you help yourself. Just a personal story. My best friend just passed away at 35 because she was so focused on taking care of her spouse and her child that she just kind of put herself on the back burner, and then it was too late by the time she went to the doctor, and she had stage 4 cancer. And mind you, just a tidbit, my best friend was a nurse practitioner as well. So sometimes it's not even just being in an underdeserved population. Sometimes it's just about who we are as people and how we feel like we're so strong and we have to carry so much on our backs. I would say for COVID-19, again, the biggest thing is education towards what the disease is, how it can affect you. You know, when COVID first came out, a lot of people just thought, you know, if you're over 65, you're the person that's more at risk. But now, you know, we're seeing 20-year-olds that are physically fit, that are, you know, falling ill to this disease and that aren't making it. So when you look back at simple things like wearing your mask, washing your hands, doing social distancing, just people not understanding that doing these small things can go a long way. And even in terms of the vaccine, I agree with the MD on the line. I'm so sorry, Dr. Mack, I forgot your name that fast.
Yeah.
I agree with Dr. Mack. When it comes to vaccines, you know, a lot of African Americans are kind of pushed back against it, you know, like, well, do I want to get a vaccine? You know, what's in the vaccine? You know, I'm sure you guys have heard, are they putting trackers in us? Are we going to get our superpowers on December 21st? Like all those little things. But when you think about it, getting the vaccine, it's not even more so to help yourself, it's to help others at the same time, because the more people that get it, the more of a chance for us to, you know, get inoculation throughout the entire community and not just for oneself. So, I mean, unfortunately, those are the pushbacks we have, and I think it starts back at education.
Jason, this next question is for you. You actually started off as an attorney and decided to build your own condom brand to basically empower the Black community to have safe sex. Just talk about the importance of safe sex and the way that plays into the current pandemic and the underlying issues that many people may be dealing with.
That's actually a really good question. When it comes to safe sex, I think, you know, we really need to take kind of like an all-in approach as we look at, you know, new solutions around unplanned pregnancy, whether it's teenage pregnancy, whether it's STIs, whether it's HIV and AIDS. I think regardless of, you know, and Michelle can provide a lot more of the actual like technical expertise, but I think regardless of a lot of the STIs or the stats that you look at, African Americans in generally impacted at a disproportionate level. And one of the reasons that was really kind of like the full force behind why I saw it to be necessary is up until we launched, I'd say about 10 years ago, there really wasn't even people of color on condom ads, right? And so what you ended up happening was you had a private sector which never really spoke to our community, right? And then you had a public sector which did a lot of work in the community, but they didn't have a lot of the resources, and they were always kind of, you know, withheld from being able to put everything into it by either regulations, rules, or just the infrastructure at place. And then what I was also able to see is a lot of the nonprofits, which, you know, the nonprofits, I love all of the work that they do. And you'll find some of the most passionate people within our community working really hard to make a change, whether it's small or large. But, you know, a lot of the nonprofits are also financed or funded by different foundations whose interest can always shift, right? So what I saw an opportunity. A lot of people don't know, but African Americans spend more than $400 million a year in condoms, right? So what I was able to see is, imagine that you could have a Black-owned condom company that not only work to educate people, to work, you know, focusing on how do you limit or work towards ending health disparities, but actually have a $400 million engine behind it, right? And think about how many jobs it could create. Think about how many, you know, teens it could educate. Think about how many, you know, nonprofits or community agencies it could work with hand in hand to be able to really create the solutions that are really necessary in our communities. And I think when I was able to combine those two, I really saw an opportunity for, you know, us to be able to address a lot of things, whether it's stigma, whether it's condom negotiation, whether it's, healthy lifestyles and healthy dating, whether it's, having the education to understand the importance of being tested. Because I think, kind of piggybacking on what, whether it's Dr. Mack, Ms. Walker, or, Ms. Allen was saying, our history as it relates to education and medicine is really tarred, right? So as a result, there's a lot of distrust and mistrust when it comes to African Americans and being tested. And I think that now carries on, like everybody else says, to, how we're now having to approach COVID, or, what's now happening around like HIV and AIDS or other STIs.
Got you. This is a question for Dr. Mack, Michelle, and Jenny. Someone said earlier, they talked about COVID-19 and the way that young adults are being impacted as well. Can the three of you talk about some of the top underlying issues that you are seeing in older generations and in younger generations as well, as it pertains to those that may be vulnerable to COVID-19 or those that are passing away from COVID-19?
Well, I can start with some of the statistics and the data that's coming out. It's been shown in the elderly population as well in children that communities of color, and especially African American, Hispanic, American Indian, Pacific Islanders, and some Asian populations, and Alaska Natives, that we do worse, even with the children. Some studies have shown that children with COVID, if you're in communities of color, more likely to be admitted to the hospital, and also have a high incidence of, while in the hospital, dying from COVID-19. And of course, we've seen with TV, with the elderly population, because we have speculated we have more chronic disease, but it's speculated and it's related to that, because that's why we have more morbidity and mortality. So I just start with that. I think research is showing that even in children, we have a higher incident of death, and some of that is because of obesity and the health risks that our children have compared to white populations.
I would definitely piggyback off of that and saying, outside of it just being an age factor, and a lot of people, if they have respiratory issues, such as if they're prone to pneumonia, or if they have a history of like asthma, COPD, so those type of respiratory issues, they're definitely at a higher risk. But when you think about our population in general, it's the diabetes and the hypertension too, which, as Dr. Mack said, relates back to the obesity in our community. It's harder to fight off these infections when we get them. It goes down to taking care of your body from a molecular level. You have to eat right. You have to exercise. You have to, feed your body with good things. So that's a big part of it with our community as well.
Before I make a comment, I actually would like to give Jason a shenanigan. Ms. Walker, I do look forward for the opportunity to work with you. But when Jason said that a Black-owned company could care about the community, I want you to understand what that means, because a lot of people might have just thought, well, how does that work? Who owns a condom company? Jason was literally in Africa, and a barber in Decatur reached out to him because he found his number on the back of the box. And he said, I have been giving your box. I've been giving condoms, and I'm out of condoms, and I've lost the number of the contact person, but I want to know if you can help me. So y'all, when there's a number on the back of a condom box that leads you to the owner, you know you calling somebody from Wakanda. That doesn't happen every day. That's the type of community involvement that people need. And I want you to know, while in Africa, Jason called me. He said, Michelle, I got a barber in Decatur that is telling me he's out of condoms. I said, okay, who is it? Because I want to know the barber in Decatur that turned over the box to find a number. And because we think that sometimes people say, okay, Google, okay, Alexa, sometimes people just need to go old school. And I literally went and got some condoms and dropped them off on the way home. But I said, I want to meet you and I want to understand how this condom distribution is working. And we got him reconnected to the resources. And he said, all of the barbers let people know we have them. We have conversations in our shop. That barber later allowed us to come back and test in his shop. We got people signed up for prep. I mean, those are the kind of things you want to see happening. And we stayed in touch. We still have a good relationship. And I had an intern who was falling on hard times and preparing for an interview and needed some assistance with just trying to get everything together. So we pulled our resources together and we got outfits so he could look nice. And I said, you know what, who can I call to get his brother a clean haircut? And guess who I called? That's the kind of relationships that when we talk about health is wealth and we talk about staying in touch with each other and working in the community, those are the type of conversations that people need to know are happening. So I just thought that I could not say anything about COVID before shouting out Jason. So for me, I want to make COVID personal and then tie it back to the conversations that we've had earlier from Ms. Walker and Dr. Mack. The first time somebody asked me to get involved in a case that involved contact tracing, the person said, I cannot find this individual. And I said, so here's what I want you to know. Nobody is hiding during COVID. It is literally on the TV every day. So there's an explanation. We can find him, but I just want you to start off with that premise that he's not hiding, okay? So I said, I want you to come to my office, and I was helping another contact tracer, and I said, let's review the medical record. And it was just like Ms. Walker said, a history of chronic asthma, all of this stuff. And so guess what? The last thing on his mind was that I have COVID because I'm used to this asthma battle. And remember when everything kicked off, the time of year when people would be used to sinus issues. So I said, when you say you can't find him, what's the issue? They said, he's not answering the phone. I said, let's read through the chart. The first page in the chart said, this number is incorrect. It looks like an 8, it's really a 3. But instead of it being updated in the record, you had to dig through the chart to find that information out. See, those are the kind of extra steps that we have to take because we rely a lot on technology. I dialed those. He said, hello, I've been waiting on y'all to call me. And I said, okay, here's what I want to know. I want to know if you can save my number. He said, I can save your number. Does that mean I can call you anytime? It does. Because you need to know that we are learning through this together. This is a pandemic together. We are learning. So you might have a question, and between your healthcare provider and the health department, we got to come together and work together because the health department is sometimes not thought of as a provider. We are thought of as this hub for people who don't have insurance. Well, y'all, for some people, they've always not had insurance. And many of us don't think of the health department as this one place. It's where you get your vital records. It's where you get your immunizations. It's a lot bigger than where you get your birth control pill. It's where the TB specialists are. It's where some people go for their HIV primary care treatment or their STD treatment. So we are really, if you think of that commercial that used to say pork was the other white meat, public health, we're the other healthcare providers that people don't always think about. And so as this pandemic has been upon us, most people have thought about healthcare and they've immediately thought of hospitals. And they haven't thought about healthcare in totality that also includes the work that is happening at the health departments. I felt like that was a commercial. So back to you, Will.
Deeper dive into that subject matter. Just seeing Black healthcare professionals, just the symbolism of that is powerful in itself. Just talk about the importance of seeing people that look like you in different verticals across the industry and the way that moves the community forward to be to live a better life, I would say.
If we went in alphabetical order, I'll just start. One thing I would like to say, and Dr. Mack said it in his introduction, mentors matter. And it means a lot when we continue to reach in the space and we connect people and help people like they helped us. And you can't talk about the Tuskegee experiments and not talk about the late, great Dr. Bill Jenkins. And when I had an opportunity to share stage with him, I was like, you have got to know, you have mentored so many people that mentor me, but what it just means in this space to share a stage with somebody like you who has done this work. So it's not that we just matter to the people we serve, we matter to each other. And it's the extra endorsement that you say, you know what, hey, what you just keep trying. You're gonna get there. These relationships matter. Especially at some levels of healthcare, people don't realize that it's not a whole lot of money. You know, there are people who have a heart and a heart to just help. You know, I said I was looking for a job and found a career. The one thing that I knew I wanted to do was to help people. And the one thing that has never happened to me is that I have not met a person I did not want to help. And as long as we keep that attitude and those kind of things in the forefront, we got to realize if my lights are not on and I don't have anybody that acknowledges that, there's not anything you can tell me about my health. If I'm supposed to eat before I take this pill and I don't have any food, so we have to make sure that we have holistic conversations and first acknowledge people. And for a lot of folks, there is a kindred spirit when you can reach out to someone that you think may be familiar with the experience in a way that there's not only just sympathy, but there's also empathy. And I think that that is very, very powerful.
I'll start out by saying, so my mom, like I said, is a home health aide. Before I went to college, I thought RN was the highest you can be. I knew that I could be a home health aide. I knew that I could be a CNA, a LPN, or RN. So my cap going into college was, I'm going to be an RN. Didn't know there was anything above it because I didn't know anyone in that field. Definitely no one that looked like me. So when I went to the University of Florida. My student advisor there was a Black nurse practitioner, and my mind was blown. I was like, there's something in between an RN and an MD? Oh, because if you don't see someone in that position, you don't know you could be the next person in that position. Definitely in healthcare, when you walk in, you know, there is like a kindred spirit when you walk into a doctor's office and the front office staff are Black women. You're seeing a Black doctor, whether it be male or female, the person taking you just feel more comfortable kind of opening up and expressing yourself. And I feel like in healthcare, that's very powerful because it's hard sometimes for people to tell the truth, for patients to tell the truth. So if they don't feel, you know, that compassion from you, if they don't feel like you know where they're coming from, it's going to be harder for them to kind of, you know, be open about what's going on, to let you know about that big toe that's rotting off so that we can check you for diabetes and, you know, dig deeper into your own personal health. So definitely if people can't see it, it's hard to know that they can be it. So that's one thing with being a mentor, that if anyone sees me and, you know, they pull me to the side and they're like, my daughter wants to be a nurse, do you mind taking a conversation with her? It can be a stranger on the street. I will always take their number and I will always reach out to them to kind of let them know, like, we're here, like we are here. And if there's anything that you need from us, we are here to help you with that.
But Jason, you want me to go first? Yeah, I think it's been said. It's trust and influence. You know, just give a quick example coming at a different angle with the COVID. Had a friend, but also someone who, you know, looks at me as a physician, and they were adamant, African American, adamant about not taking the vaccine. Could come up with all the reasons not to. And I'm telling you, when she first started talking, you thought you could never convince her. All I had to say was I took it and say a few words why she should take it and protect her family. She called me about a week later and said, Dr. Mack, you won't believe I took the shot. I'm going to get my second shot. So she seemed like she was, stone, hard as a stone against taking it, but it just took that influence. So I think it even goes back to the family and why with this vaccination is so important that leaders within the family influence others to take the vaccine. But it also comes to that when it comes to your career. That influence of someone you trust means so much in multiple ways. So I think that's what it is for seeing somebody of a like background culture, that trust and influence really goes far. So I think that's important.
I'll tell you a little bit about my experience. I feel 1,000% the same way. For me, knowing other, just Black professionals within the healthcare industry has been literally central to my professional growth as well as personal growth. And I think what I've tried to do is also be able to look back and see how I can then, leverage my place within this industry to be able to also educate the next. But to never see people like I grew up in Massachusetts, right? So in Massachusetts, then in my area, we had a lot of African Americans, or a good number of us, but not many of them had been able to go and reach like professional levels. When I moved to Atlanta and I went to Morehouse, that was my first time really seeing, Black men that looked like me that went on to become doctors, that went on to become MD, PhDs. To me, that was always something that was kind of like impossible. You almost had to be like Paul Robeson, right? To be able to, you had to be like the super Black man to be able to reach those levels. And I think what Morehouse did for me specifically was it normalized us. And I think even when I look at the very beginning of, B Holding Group, B Condoms, being able to have a network of Black professionals also served as a launch pad for my business as well. Michelle can tell you, my first year that I started the business, one of the first people to really kind of be able to support was Morehouse College, right? And one of the things that they told me was that, we don't buy our condoms, but we get them from the state. And, 10 years ago, by the luck and by gratuitous fortune, I was introduced to Michelle Allen. And she was literally the first person to give me an opportunity to provide, condoms at a state level. And then I think what happened from there was not only did she give me that opportunity, but she also served as an advocate to say, I see the way that you run your company, and, if other states have questions about your capacity or your ability to be able to supply, give them my number and I'll serve as an advocate. And I think that those types of relationships and those types of bonds are necessary, not only in both the public and private sector, but it gives you a level of comfort that somebody can understand your experience and your pathway and be willing to want to support. And I think that that's part of the main reason why I always say, having a strong African-American, health professional network is critical, because I think, all of the stats show that, our experience when going through medicine is completely different when we have a Black physician versus when we don't. A lot of times, you'll read studies where mainstream white physicians may feel that, our thin is thicker, or, we're a lot stronger. We don't endure pain tolerance. Our pain tolerance is so much greater. And that's just by people not really understanding, who we are as a people. So that's why I'm a full proponent of just making sure we have more people that look like us, that reflect us, and that really represent our culture and the health careers.
I love that. I love that. This is a two-part question for the entire panel. You all live the lives of Black men and Black women, so you understand the issues as it pertains to health that many of us face, or many of our family members face on a day-to-day basis. Can you just talk about some of those issues in particular, the specific health conditions that increase the severity of the COVID illness? or some of the issues that people are facing during the pandemic as we speak?
For me, I have asthma, and I have laid family members to rest on both sides of my family from COVID. And I think about what I do. I know that oftentimes it is not uncommon, especially in the South and communities of colors, for African Americans to have a large burden of asthma. And so just explaining to people what that means and how it could complicate a COVID battle. Also, other comorbidities that I've seen in my family were also connected to diabetes. And so I think that it's good for us to have the conversation so that we can educate each other. But I also think it's good for conversations to be normalized. So talking about your health and talking about the fact that your health is your wealth. I think it was Ms. Walker that talked about even the importance of diet and a proper exercise. Like, you know, we want to get moving. And no matter what the diagnosis is, it's going to go back to a healthy life being part of maintaining after you get through the illness. So I think that we have an opportunity to talk about health in a holistic way. So remember, I said earlier, my space is pretty stigmatized. And I actually saw a picture, a mask was sitting on a bench. And when he looked to the left, he saw a condom, and the condom simply looked at him and said, people don't want to wear me either. And there are certain conversations that we don't have because they are so stigmatized. But I think that this is creating a new opportunity. One, we hear about it in the media day in and day out. So let's just talk about our health. Let's talk about being healthy, and let's talk about how we can be accountable and support each other in that space.
Yeah, agree, Michelle. And I think when you think about the health conditions, quickly, let's just think about the virus. What does a virus do? Just like any virus or the flu, basically it lives to attack your immune system and to get you sick. And it thrives on us coming together and jumping from human to human. And basically, the weaker your immune system, the more opportunity it has to attack. So that's chronic diseases, you know, the diabetes, the hypertension, but also cancer, leukemia, asthma, and, you know, all those diseases that affect your respiratory system. So if you're at risk of those diseases and you have those, you have a higher risk of actually getting it because you have a weakened immune system. Your defense against the virus is not as high. So there are multiple diseases that put us at risk. But again, people of color, we have more of those diseases, more of that asthma Michelle's talking about, the chronic diseases. And to your second question, what are we facing outside of just the increased morbidity, sickness, and death? Excuse me. Hey, look at us. Look at those social determinants, the determinants of health, right? Loss of jobs, food, income, employment, transportation. Those things put us at risk, but also they're put at risk, right? When you're sick and you lose a job, you got to work so many jobs and you can't get health care, things of those natures. So it's not only affecting our health, it's affecting our access to the health system, and it's also affecting anything that's related to health that, you know, that's part of our lives.
One thing I wanted to jump in and say about that is when we look at, you know, especially our community and the people that are dealing with these chronic disease managements, it's simple to say, change your lifestyle and these things will change. One thing about the Black community and healthcare in general, we feel like, well, I'm taking a pill for this, so I don't have to do anything to actually correct the problem. But the pill is kind of putting a Band-Aid over it if you're still doing all the things that led you to having the disease process in the first place. So, you know, having diabetes, hypertension, having asthma, the things that can kind of be reduced in a sense in terms of if you eat right, if you exercise, if you decrease, you know, your body mass index just by at least 10%, those little things that you can do to help boost your immune system go a long way when dealing with COVID-19 and fighting, you know, these disease processes. I also wanted to go a little bit further on what Dr. Mack was saying. All those social determinants that people are going through, they can also lead back to mental health, which then, you know, perpetuates a bigger problem in our community, because that's a part of the healthcare system that we're kind of so far removed from in thinking, you know, well, we don't tell our business, or I'm not going to go see somebody for this. I'll just pray it away. Like, that's a whole nother conversation we can get into, but that's a part of that social determinant, us not having those social interactions, us getting sick, losing jobs. Those are the type of things it can lead to.
Got it. This is a question from our audience for Dr. Mack specifically. Is there an area of medicine that you would encourage future aspiring Black daughters to consider, those that want to make meaningful change in the Black community?
Yeah, thank you, Will. I was just typing it in. I would encourage you to go into primary care. I think each one of us are kind of like on the front lines. Primary care means like family medicine, internal medicine, psychiatry, OBGYN, surgery. You know, not that, but family medicine and the ones I spoke out. But like, you think about mental health, you think about the frontline workers who can take care of about 80% of the people who come into practice. You know, that's your family physician. You think about mental health and the impact on our community. That's your psychiatrist or your psychologist, and not just MDs, right? As we said, those in public health, physician assistants, nurse practitioners. These are the physician assistants and the nurse practitioners. These are the ones who are taking care of the rural communities. We've seen and I've worked in the retail, what was once called retail health clinics, the minute clinics. And so you see how much of the care in the United States has shifted to these areas. So you don't have to be an MD. Just pick some health related professional field in which you're on the front lines, whether it be public health, primary care, or even within research. And let me say this, and I'll end with this. Everything that's been effective to decrease flu, when you look at the sexually transmitted infections, when you look at pneumonia, it's been because of public health, primary care innovation. You look at it, what's happening with COVID now with the vaccines, right? You got the vaccine, that's the innovation in the discovery field, but it takes public health to get the message out there and to distribute it. And then it takes the primary care to actually give it to and educate the communities and give the shots. Same way we're talking about condoms, we're talking about the STIs today. It's a marriage of all of those. So we need people at all levels of the health system, and no one is more important than the other in the contribution to the public health.
Taking a deeper dive into STIs, STIs. This is a question for Jason and Michelle. Are there any specific protocols that you think people should follow as it pertains to safe sex and just ensuring that that they're not contracting any STIs or any diseases that could impact their life in a negative way?
Michelle, I'll speak just really quick. I would say the biggest thing is just, always know your status. Don't be afraid to be tested. Don't be afraid to have that discussion with your partner, and be comfortable. Understand that, you know, knowledge is power. And when you know your status, you're comfortable. You know who you're dealing with. I think it just makes for a much more positive and cohesive unit between, you know, somebody and their partner, and it also helps to be able to, you know, minimize exposure to you know, other people outside of that intimate space.
I agree with Jason 100%. Know your status is sometimes associated with HIV, but know your status needs to be associated with your sexual health. And so one thing that I would like to tell people is to make sure when you're getting tested, you know what you're being tested for. I've had a lot of conversations with people that said, I got tested for everything. And I was like, okay, so let's be clear. We don't have a test called everything, and we don't have results called it's all good. So you want to make sure you understand what you're being tested for. The other thing is you also want to make sure you understand the differences for things in terms of how they're being used for prevention. So, for example, flavored condoms are for oral sex, and that is a little bit different from what people sometimes think when they just go and pick up condoms. So condom negotiation and condom education is very important. You also have things like dental dam, and people having an opportunity to take advantage of the resources to make sure they get good information is also very, very helpful. I think that it is important to have forums like this so we can have the platform to share. And let's just, everybody is not going to walk into a health department. And if they do, they might not always have a person in action. They might just walk, grab some condoms and walk back out. So any opportunity that we have to share the education and encourage questions and encourage prevention being a cure, because prevention is a cure. And we can have a place that we, again, normalize and destigmatize conversations that will ultimately end in people having an opportunity to have better health.
And Jenny, what about you?
To piggyback off what Michelle said, because it's so prevalent when you're in primary care, 100%, don't just go into a doctor's office and say, I want to be tested for STDs. Some doctor's offices have set STD panels that don't include everything. I've had patients, like Michelle said, come in and say, well, I know I'm negative for everything. Did you get tested for hepatitis C? Did you get tested for HSV, which is genital herpes? So a lot of doctors have these preset order sets for STDs and things like that, and you're not really getting tested for everything. In terms of condom use, I've had patients come in and say, you know, I want to be tested for pregnancy. And I'm like, okay, well, are you using protection? And they're like, yeah. I'm like, well, what makes you feel like you need to get a pregnancy test then? Can you walk me through what you're actually doing to prevent yourself from getting pregnant by using condoms? And I've had people say, well, I have sex, and right before he ejaculates, he pulls out and puts the condom on before he ejaculates. And I'm like, what is happening here? So knowing what to ask for, definitely, and knowing how to use the tools of prevention that are out here for you.
And Dr. Mack, do you have anything to add to that?
I was saying, my mic was off. I was saying, Jenny, that's a new one. I hadn't heard that. That's all I can add. I think they've said everything around the STIs.
Got you. Now, the conversation tonight has pretty much touched on a lot of issues, and it just made me think about the systematic impacts, the systematic issues that people of color deal with on a day-to-day basis as it pertains to personal health. Can you just talk about some of the systematic issues that you've seen people face in the Black community as it pertains to healthcare, and in what ways are you specifically combating those issues that we're facing on a day-to-day basis?
Well, I can start. I think that goes back to those determinants of health. Some call it social determinants, social economic determinants of health. Um, Access to health care and the barriers to access. Education. It's been found that education, lack of, is connected to your health. The lower your education, the worse your health. The better your education, the better your health. And sometimes that can go off into your lifespan. So education, transportation, physician bias, and physician bias can even be among physicians of color. A Black physician can have bias against a Black patient when they come in. So there's a lot of issues, systemic racism, that actually affects our health and affects the way we look at health, way we access health, and our confidence in the health system. So those are the things. I think the solution is to continue to identify them, research them, forums like this, discuss it, educate the community, but also come up with solutions within the health system. And that includes logistics. Part of the issue now is logistics with the vaccinations, right? So the resources and demand through the political system, we have to have resources in our community, and we have to be in the front of those resources. The people you see on this call today, these are the people who you want to do the strategic planning for resources within our communities. We have to put our own people, and we have to get to the point that we're providing those resources to those who know best.
Anybody want to chime in on that?
I was thinking, Steve, repeat the question. You know how you play Family Feud and somebody give a good answer and then you don't remember? Because I was over here like, good answer, good answer. I was like, I do think that it's very important to also be transparent that when something happens, it needs to be reported so it can be resolved. And so you want to make sure that you have a teachable moment. I was invited by a community-based organization to participate in a focus group where people discuss their experiences with the health department. And someone made the comment, when we come in, we might be classified as a number or an alpha character, but we definitely should be always treated like we're a person. And so you ask very personal questions, and you can just lead in with a greeting. We get right to it in sexually transmitted disease clinics where people are asking very personal questions. And I thought it was worth noting. And they shared experiences, and we took them back. We also asked if there was an opportunity for the agency to provide capacity training around cultural sensitivity. You have to remember that words change and evolve, and things that were appropriate to say 20 years ago are not appropriate to say now. And, you want to definitely understand that once a person is aware, there's an opportunity for change. Also, for me personally, I had an encounter with my physician that during an exam, he counseled a test for specifically syphilis, but he didn't say syphilis. He identified it by the medical name of the test that he was counseling. And I said, I noticed that you counseled that test without asking me. And he said, well, do you even know what it is? And I said, but you didn't counsel any test that was around diabetes. You didn't counsel anything that was around hypertension. But then he later said, well, aren't you married? And so it was a teachable moment, but this happened during my exam. And I told him, I'm proud of myself for even having the courage to speak up and challenging you when I'm really just have on a napkin. And he said that, well, I didn't think you needed that test because you're married. Well, why not ask me about my health? And so we can have the conversation in a real way. And I think that as we talk about education, also making sure that people feel comfortable in advocating for themselves. When people go and buy a cell phone, they literally ask 50 questions. about the price. When's the next one coming out in the megapixels? And you go to the doctor's office and they say, any questions? And you say no. And sometimes that no is taken as you don't have any questions. And really the no may also be a silent cry for saying, I don't know what to ask.
Mm.
And you definitely shouldn't feel embarrassed by that when you're going into, your doctor's visits, the hospitals, anything like that. But if you feel like you may, kind of go into yourself when it's time to ask questions, bring someone along with you or write your questions down beforehand. That way it's easier for you to remember, because a lot of times what does happen is, we get into an appointment and the doctors are throwing all these big words, all these tests and stuff at you. So at the end of your visit, you're just kind of like, did he just say I'm dying? Because everything's just coming at you at once. But if you prepare yourself before going into the visit, it'll be a little easier for you to communicate your thoughts and your needs and everything with your provider as well.
My next question would be, a part of the systemic issues is misinformation as well. I heard someone say earlier that education is key. Can you just talk about some of the myths or misinformation that you continuously debunk on a daily basis as it pertains to patients, and just talk about where people can go to get the correct information, because there's so much information that's floating around on social media that's just plain out wrong. But just talk about some of the myths that you continue to debunk on a day-to-day basis, and can you provide our audience with some platforms or resources that they can go to get accurate information about personal health?
I was at a school and I was giving a talk, and somebody said, I heard if you drink Mountain Dew, it lowers your sperm count. And so if you are drinking Mountain Dew, you can't get a girl pregnant. And so sometimes things sound silly, but you want to understand the mindset. And I said, now for me, Mountain Dew's slogan is do to do. I would have thought if you came up with that, maybe you would have went after Coke Zero or something else. But they said, well, no, Miss Michelle, it's because of the color. It's because it's yellow. So I said, I want you to understand that I have not been familiar that Mountain Dew lowers your sperm count. So instead of just saying something is utterly ridiculous, explain it in a way that they can also understand. I heard somebody say that if a girl smells funny, and in this particular instance, the smell funny, they were talking about fish. If you pour Kool-Aid on her, it'll kill the smell. So then I said, okay, so let's talk about why should it smell like fish? And so the class said in unison, it all smells like fish. Women smell like fish. And so to help them understand, I said, people don't smell like fish. Now I said, fish don't smell like people. They said, true. Okay, well, people shouldn't smell like fish. And so just having the conversation around, let's start with what you think, and then let's walk to the reality of it. And a lot of times people think about the CDC, and CDC is a great place to get information. But also you do have your local health departments and your state health departments. And there are hotline numbers where you can get a lot of the same information. And, there's a lot of misinformation out there. And I can tell you, y'all, every time somebody tells me one I've never heard before, I really write it down and then I reshare it, because it's widely believed. I think I was at a Upward Bound. And so these kids were talking, and somebody said, well, I heard that sperm tastes like sugar. And I said, okay, so let's walk through that. Let's help me understand where you got it from. And really the confusion was around the fact that the sperm has glucose to move, not as a sweetener. And I think when you have the conversation in a way where you are not just sort of poking at the person for not knowing, but you're really using it as a teachable moment. And I mean, I have shared laugh with kids and I go, okay, let's break this down now. Y'all got me scratching my head. and it's okay, but you want to make sure you don't leave where people don't understand when something is just wrong without correcting them.
Yeah, I think good points. It's so many myths out there, and people believe things for different reasons. And like you say, that was the foundation. The foundation was the glucose, right? So when you get to the bottom of it, sometimes they have a good reason. When you look at what just happened at the Capitol, you know, people can believe almost anything, and social media is so prevalent today. I think before I went into the profession, you know, everybody trusted in their physician and everything their physician said, which was wrong also. But today, people go to social media um, for what they think is valid information. So I would just say, seek the health professionals. You know, we talked earlier about why it's important to have people of color, people of your culture in these professions to trust. Seek out health professionals, whether it's public health, whether it's within the traditional health system, whether you know it's like with the what we're doing with the condoms. You know, some business owners, trusted sources, and please don't just believe things that are put out on Facebook. Um, non-certified, non-verified sources, and that's what I would try to tell people. Try to seek those certified, verified sources and health professionals. And if you have like a profession you're working with, a physician, primary care physician, I think you need to seek some of your answers there.
And there's a reputable website for pretty much every chronic disease management out there. The CDC is amazing. If you want to read up on diabetes, there's the American Diabetes Association. They have diet plans, they have exercise plans that can, you know, help you through the disease process. There's the American Heart Association. So there's always a more reputable site than just putting it in Google or, you know, asking a friend who may not know. Seek out a provider that you feel comfortable having these conversations with. Always remember, you know, your insurance a lot of times will pay for health coaches. They'll pay for nutritionists. Like they'll pay for these different providers that can help you along the way in making sure you're leading a healthier lifestyle. One thing that I'm doing now is a diabetic education class for my company. And one of the myths, even though, you know, it may sound like the simplest thing, but diabetes isn't always caused by excess sugar. Like a lot of people don't realize that diabetes is a disease of the pancreas. So it may not be that you're putting a lot of sugar into your body. It may be that your pancreas isn't producing enough insulin to direct the sugar to the right places in your body. So that's one of the main things I'm trying to educate people on now is, again, it starts back with lifestyle modifications, getting your physicals, knowing your numbers and things like that, or even knowing what your normal blood sugar level should be. All of these are things that you can find on reputable sites. If you just take the time to look for them, or I don't know if that's something we can do, if we can shoot out a couple of the reputable sites, that way the Health is Wealth moderator can post that for you guys.
Hey, Jason, do you want to add to that? I think you may be on mute.
Jason, you're on mute. You can't hear?
I don't think he's looking down. There you go. There you go. There you goes. You were on mute for a little while, so you can start over. I think he's on mute.
Can you hear me? All right,
Now I
can
can
you
hear
hear me
you.
now?
Now I can hear
Okay.
you.
No, I'll say one of the things that we took part in recently is we distributed about 250,000 free condoms throughout Atlanta, leveraging barber
I think Jason's connection may be. Jason, can you hear us? Yeah, I think Jason's connection is messing up a little bit.
Can you hear me?
Now I can hear you. Yeah, now we can hear you.
Sorry. Hello. Hello.
Now we can hear you. Jason's connection is messing up a little bit, so we can move on to the next question. Any advice for individuals that are navigating the pandemic at the moment?
Can you hear me now?
Whether it be now we can hear you.
I can't hear anybody.
I'll move on to the next question. But as it pertains to advice to individuals, Black people, or just people in general that are navigating the pandemic, do you have any advice from a dietary perspective or just a personal health perspective, just in general, so people are less susceptible to get COVID-19 or just any underlying condition that's been plaguing the Black community overall?
Yeah, I guess I'll start. There have been some studies that show that from a preventative perspective, protective perspective, when it comes to COVID-19, the importance of vitamin C, vitamin D, and zinc, omega-3 fatty acids, probiotics, and garlic have also been studied to show some effectiveness. But I would, if you can't remember all that, multivitamins, multivitamins have been shown, and sometimes it covers a number of those things. So I would suggest that. And we said some of those things. The importance is to stay active, make sure you're getting sleep. The importance of trying to eat a healthy diet, stay away from the fats. Eat more vegetables, fruits and vegetables, and less of the fats, fatty meats and the breads, etc. Self-care is so important, and mental health, and not drinking, of course, and drugging also. But this is a time when people are home by themselves and they're drinking more. So self-care and coping with that stress and turning that TV off, getting outside and walking. People, you probably heard that the more you watch TV, the more you associate your likelihood of getting depressed. People don't realize that. But you have to turn the TV off, have to get up and move and walk around, keep yourself active, and also stay engaged. This is already a social media world. People are isolating themselves more now. And basically, that's detrimental to your health too. So I do want to say this, and I think Jenny said this earlier. There are a lot of reasons why there are disparities, and there are a lot of things that block us from health and that work against us. But we have to do our part. We really have to seek care, prevention, as we stated, seek these information in the right places. We have to be active in our care. We can't blame it. And that goes the same thing with the vaccine and the vaccine trials. There were times when they didn't have us in trials when it came to prostate medication and these vaccines. Now we have those opportunities. There were times when we didn't get the vaccines, even though we're not getting them at an equal rate today, but now we have access to them. So we have to be active in our community as a community, but also as individuals to seek out and to care for ourselves. We have to be active in that piece.
What I have been telling or advising people to do is to have an accountability partner. Going through this pandemic right now is tough on everyone. So if you can find your cohort or a group of people that are like-minded, you guys can have Zoom sessions where you exercise. For the diabetic class that I teach, we do twice a week workout sessions for 30 minutes. It's recommended that you do 30 minutes of exercise 5 days a week. That alone gets them, back into kind of like that social aspect where they're able to connect with people. People that maybe are going through the same struggles as them, they get that 30 minutes to just kind of relax, unwind, and get their physical activity in at the same time, but kind of take it out of their mind about what's going on out in the world, because it can be so much. Every time you turn on the TV right now, all you're hearing about is COVID-19 or the president. And so all of that plays a toll on your mind. In terms of diet, of course, everything that Dr. Mack said is really important, that you're watching what you're putting into your body. I mean, your body is your temple. It's what's keeping you moving. It's your machine. So as much, if you have a premium car, you're not going to put unleaded gas in something that requires premium gas. So you should treat your body the same way. Make sure you're feeding your body with those good nutrients, taking your multivitamins, drinking water. Another big thing that we stress to people, our bodies are made up of 60% of water. So if you're not gonna, drink water to replenish that, that's a part of building your immune system up as well. So prevention, those lifestyle modifications, and having that outlet for yourself.
And Michelle?
I don't have anything else to add except for the general reminder of wear your mask and socially distance. I know that after sheltering in place orders were lifted, people took that in different ways. Some people thought it meant that, okay, well, we can just go wherever is open. And, as you visit an establishment that may be open, you still want to follow those guidelines of being socially distanced and wear a mask.
And my final question would be, and this is for everyone, what are the most critical changes that you think need to be made in the healthcare industry to ensure a better future for Black people? And what is your call to action for Black communities in Atlanta to live a better life?
I was literally asked this question right after the Black Panther, and I said that we needed vibranium. And that I thought that T'Challa would help us to channel some things that are some critical gaps. Certainly, I think that a lot of what we have said earlier is just a closing reminder. Mm-hmm. You definitely want to ask questions when you have encounters with providers. You do want to make sure that you are visiting reputable websites. And thank you to Ms. Walker for saying reputable websites to get information. And I like the idea of when we say there's a call to action, because a call to action means do something. Y'all, let's get healthy. Let's get moving. Let's get it. There are a lot of anthems that we have that we come together and respond. But if we are really going to talk about our lives and how much they matter, then we also need to add into the conversation, our health is a part of that. And if we matter, then we don't matter just in one facet. We matter across the Walker said they are. We want to think about our diet. We want to think about our exercise. And see, I don't like that health is divided up into different brackets. The one thing that I love about smoking is that when we have the conversation, we don't pick people who we want to stop smoking. We tell everybody to stop smoking. And so sometimes in some of our other spaces, we are so targeted that if you don't have a person connect directly to what you're saying, they feel like you're not talking to me. And many years ago, when we were dealing with HIV/AIDS, one misstep was the African-American community never felt like you were talking to me. You are talking to people who live this way or people who use this type of drug. And so what happened is I think that we had some missed opportunities with people recognizing that we share risk factors. And we're not just talking about one group, we're talking to all groups. So I think that those are some important nuggets to just think about. Like if we truly matter, let's matter in all our spaces.
For myself, in terms of the healthcare industry, I would say advocacy and education. To piggyback off what everyone has been saying, it's especially in the Black community, when we're going into these healthcare spaces, we need to have a understanding of what's being told to us, how to improve our livelihoods. Black Lives Matter, but I mean, your life is a part of Black Lives Matter. If you kind of get what I'm saying, it's not just about police shootings and police brutalities. It's also about what you're doing to your body. So having that education about what health actually is and what health means to you is going to be a big factor in how, we view ourselves and how we realize we should be treated in the healthcare space. In terms of call to action for Black communities in Atlanta, what I would say is consistency and execution. And I mean, this goes for myself too. You know how a lot of times you can say, I'm going to go out into the community and do this, but you may do it for 3 months and then you may stop. So that's one thing I would say as a community we have to get better at. In terms of, healthcare, we may say these underrepresented populations, they're more prone to obesity and things like that. But are we going out into the community and leading Saturday morning walks? Maybe on these walks, we can talk about the different systems that, Miss Jenkins and Mr. Smith are having, and we can maybe help direct them to a better path to get that healthcare that they need. So I think in terms of the call for action, once we call for that action, we need to stay consistent on top of it and execute that action.
Okay. Well, one of the best things we did lately for our health is we voted, right? Let's look at that. It's a potential now for vaccines to get to our community just because of the political change. It's a potential for Medicaid to be expanded, more health care for those people who are uninsured and underinsured. And you've heard some of the panel say this a little earlier. We have to empower ourselves. We can't wait around for the health system itself to take care of us. We have to be part of the health system. As you see these leaders on the phone, Jason, Jenny, Michelle, whether business owner in the health field or active as a healthcare provider, we have to be leaders within healthcare, participants within the healthcare system, but also those social determinants, right? We have to be educated. We have to encourage our community to be educated, our kids. We have to educate ourselves. That way, we begin to control some of these resources, put the resources in our hands. We can't wait on others to do it. We have to be part of that system to make sure it happens. Yes, we need to be treated fair, but we have to demand fairness from the community, from the political system, from the health system. So those social determinants that we talk about, yes, let's keep pushing for change and what others can do for us, but also within our community, within our houses, within our family and our homes, the things that were just said about, seeking your own care, eating healthy. It's going to start one family at a time within our community, so we can get a change. And that's the way we get the health system to change, through our vote and all those other things. So it's multifactorial, but we got to push for all those things.
Hello. What I would recommend is a combination of what I think everybody has said, which is, I think part of it is, as a Black community, really us taking hold of our own kind of collective community health and seeing how we can move it forward together. In addition, I would say maybe stronger collaboration between both the public and private sector. I think that there are a lot of good organizations doing a lot of good work. And I think one of the major challenges a lot of times is that the results or a lot of the information or research that is gained from maybe one area isn't necessarily shared in real time with other areas. So as a result, we're not really able to come to some of the solutions as quickly as we can. And in terms of Atlanta and really kind of catapulting into us really finding new ways to make sure that health remains wealth, I would just say, continue doing things on a micro level, realizing that, change comes from bottom up. So similar to kind of what Dr. Mack was saying, it may start with one family, one discussion. Everybody has a role and everybody can play their own part within making it better for everybody moving forward. And I think as long as we kind of keep that in mind, one pebble can make the ripple that can then make the long-term change that's needed in the community.
Love that, love that, love that. It's truly been a pleasure to moderate this conversation. There was a lot of insightful information that was given to our audience. So I definitely got to thank you all once again for, number one, being on the front lines and really creating meaningful change in Black communities, pushing people to live better lives, and just joining us tonight for this conversation, because it's definitely dialogue that's definitely needed in our community. So thank you all for joining us. I'm going to pass it back over to Brother Jared Fields so he can close out the night. But thank you so much for joining this powerful conversation tonight.
All right. I want to thank everybody for agreeing to speak tonight. This was a very dynamic panel. It was a lot of great discussion here. Our main focus was to curve the conversation from COVID and really focus on personal health, because without personal health, we can't do anything. I want to thank all the panelists. I want to thank Dr. Mack. I want to thank Ms. Walker. I want to thank Jason. I want to thank Will for moderating. Everybody did a great job. This was a great conversation. I'm happy we were able to have it, and I hope people were able to benefit from this. And again, to all the viewers, thank you for tuning in tonight and watching us on one of our many panel discussions that we have. Please look for our future panel discussions and our future events. Please follow us on social media, follow us on our Instagram, and follow us on our Facebook, Emerging 100 South Metro Atlanta. Also, follow our 100 Black Men of South Metro Atlanta social media pages as well. Thank you all for coming out, and have a great night. Have a great one.